we should get something to drink. Not wine. It's too early. Coffee. Let's get coffee.
Last time there was a little too much wine.
Right? Okay. Perfect.
Cup of coffee? With no booze in it?
No.
No booze. Well, this episode is all about Brandon's boobs.
Tits.
His
My
tits. Or non-existent tits now. This episode was quite serious in tone, but we want to be really positive.
As heavy as this whole subject was, yes, it started out as something that I disliked about my body, but I also want people to know that this can turn into a bigger issue. What motivated me to actually have this done was that I found lumps, and they were fibrous lumps, and my mother has fibrocystic disease, and my grandma and all 5 of her sisters had double mastectomies, died of breast cancer. My great-grandmother died of breast cancer, and I have a male cousin who is a breast cancer survivor.
This subject matter is something that has plagued Brandon and his well-being for a long, long time, ever since childhood.
Yeah, boob plague, I think.
Boob plague.
This is boob plague. So for everybody out there that's wondering about, oh, you shouldn't do this, you shouldn't do that, this was about how I felt. I didn't feel like I could do and be the things that I wanted to.
You've had your surgery. This is the following day. Your first post-surgery appointment, and we're seeing Dr. Cruz's work for the first time. Let's show them.
Yes.
So I'm going to have you stand up. What I'm going to do is...
Use my thigh muscles.
Yeah.
Craig's taught me that.
And strains, you said, are starting to slow down a little bit.
So in terms of this, let's just... Do you have shapewear? Like a spandex?
I'm wearing these.
And these are the ones that come up?
These are the ones that I brought that come up. I don't know if you need
Up and over
higher.
your abdomen, of the belly button?
I don't know if they come up as high.
Because this is very uncomfortable for what it does. What we'll do is we'll put this over it.
Okay.
And you're not going to have really any oozing. That's the beauty of the drain. That will stop a lot of that.
Wow. That's amazing.
Actually, interesting. The fun part is the flanks.
Wow.
So what I'm going to do is, actually what I'd like to do is go ahead and just run your hand over your flanks. Just run. Remember we're loving what we do? Yeah, just having that gone.
And it doesn't feel like it's part of my body.
Yeah, it's gonna feel numb, but having that gone. Remember, we have to get just things to lay flat.
Okay.
So what we're gonna do is, let's see what you have for shapewear. I'm gonna bring this up. Can you help me bring that over? What I want to do is, again, just get things to flatten out. The more we can just get things to do that, that's that. And then we can put the binder over.
Okay.
He's got horrible camel toe now, but other than that, he's okay.
So anyways, let's go ahead and move upward and onward. And we just leave the A sign just for today. You'll be wearing the vest, like we said, for 6 weeks. And
That's
that's
interesting. I didn't feel this side as much. Last night I kind of felt a little bit this side, but I didn't feel this side as much either. So
well, we did have a little bit more work on the right side. Your right side was a type 5, or your left was more of a type 4.
looking in that picture, yeah, I can.
And again, it's going to take 6 months for your skin to rearrange and do exactly what we want it to do. And you're going to have the sutures. But you are going to notice.
Wow.
The flatness. So again, all your skin has been basically taken off of your chest, rearranged, and it has to find its way back. But what is no longer there is the breast tissue. So even these little puffy areas, all that fat even around your pec has been removed, so that's going to lay flat. So what we need to do is just continue with the compression and get it to do that.
Wow.
But
It looks like I'm looking down at something totally.
yeah,
Someone's totally different chest.
It's so flat.
it's where we want to be. So,
Brandon.
Is this making it look like you have a third nipple?
If there's an implant or two hanging around, chances are I'm going to juggle them, right?
We should borrow some when we have.
For what? What do we need?
Stress relievers. I don't know.
What the office didn't know we were doing while waiting in that office room. Brandon, now that we've seen the stomach and the liposuction and we're moving up to the chest, I was this close to catching that first moment of you visually seeing it, and I got a little bit of a clip of you and Dr. Cruz talking, and you could see in your face just how grateful you are.
thank you. Yeah, thank you.
I could see my penis for the first time.
It wasn't that severe. Those are some sexy nurses.
I'm sure the reason they didn't show them during the episode is because it would actually look staged.
Yeah, it would. I feel like we should be reversing taking photos of you. You're so pretty. That'd be so wrong. That'd be so weird.
They're so, you guys, they're so beautiful, so nice, so smart, so thorough.
But more professional before any of that.
Yes.
Like, they know their stuff, and the way they deliver all the information is so thorough, and it makes you feel so comfortable and like you're on top of it all, right?
I love that.
Yeah, here's just a couple of examples of that. We love you, nurses. It's such a huge difference.
And it's only going to get better because right now, what I was just telling him, he has a lot of swelling. So he's actually puffier right now in these areas than he even started with because of all the swelling and the fluid he still has in. That's all going to shrink in. He's going to have a very nice chiseled look. People don't understand it's a condition. They don't have guy friends that they're talking to it about. So they think it's a deformity and they don't know it's a condition. So that's why they're so ashamed of it. They think they're alone, that nobody else has it. Why was I born this way? You know, and it seems that's kind of the response we've got from so many patients that most of them don't even know there's surgery, and that's why a lot of people have waited till they're so late in age to come in, because they've avoided beaches and lakes their whole life thinking that they were just stuck. They've tried working out, they've lost the body fat, made it more pronounced, tried gaining weight, you know, and it's just like that never-ending cycle until they've figured out that there is a fix.
I used to not be able to wear this shirt because it looked like I had huge Madonna coat tits.
You know you're still going to flatten quite a bit.
Which is great.
Yeah, your skin basically, it hasn't retracted back to the muscle, so right now it's just hanging there. So it actually looks puffier than what it's going to be. You'll notice that actually retracting and shrink wrapping in the next couple weeks.
Great.
Do you get a lot of cases that are minor, like fitness people that are freaked out that there's puffiness or things like that? Or do they wait until it's so obvious as an issue and then they feel comfortable doing it?
You know, really both sides of the spectrum. I mean, there are a lot of patients that you would look at and go, you know, what are you doing here? But you know, to them, you know, they work so hard on their body, and then and when it gets warm out, their nipples will puff, and that's just unacceptable, because these are people that are, you know, they've really taken good care of themselves, and
Right.
and they just they don't even want to have to deal with that.
It's so
Do you want me to help you? Yeah. Very good.
What do you do if your nipple came off with it? Happy Halloween.
With all the scar tissue, I mean, your tissues are stronger than ever, essentially. And you're at the peak scar tissue formation phase, too. So,
How does it look?
it looks amazing. You have, I mean, your incisions are essentially, they're almost invisible.
Wow.
And you're not even hyperpigmenting. So these look amazing. Yay.
Follow-up appointments are really important because it's the opportunity that Dr. Cruz gets to check back in, make sure everything's looking good. And this is 4 weeks from surgery. Do you want to see it?
yeah, I look good.
Damn, you look good.
What are we about? 4 weeks?
4 weeks.
4 weeks?
Yeah.
If we were exactly 4 weeks.
Yeah. That's fantastic.
And of course, we have a little fun with it.
I'm not showing my chest
Right.
exposed until the summer. Because
Right.
then I want it to be like
Right.
perfect.
Like a coming out
Yeah.
party, debutante
Yeah.
party, you know?
A second coming out party. Yeah.
That's right.
Every photo that you had with them, we turned it into a photo shoot.
Every photo we take, we turn into a photo.
What are you talking about? Chin up and you can smile a little bit. There we go. Another 4 weeks flew by and it's time for your 8-week follow-up visit. And really apologize for the fan noise in the back. I didn't realize that it sounded like we were like in a wind tunnel until
Yeah.
afterwards. So sorry.
This one you almost can't even see, so I'm telling you, this is going to be unnoticeable in 6 to 12 months.
It looks good right now.
Yeah, I don't.
It looks good,
But
it's
I'm looking at perfection, though. And you know, when, because I want you to be able to shave and go to the beach and not even have someone have a second look at it, except how good you look.
Well, no one else is going to be able to get a second look at it. It's me. It's me. Every time you have a follow-up appointment, it looks better and better, right?
Mm-hmm.
And like,
Really?
The scarring,
What scarring? I have no scarring.
well, it definitely eventually goes away, but each stage was better and better.
More a little bit away. And then last one facing the blue screen. I almost got it. You look great.
You're silly.
You guys follow directions. Your doctors, your nurses, and your
spouse.
Your spouse. They give you directions for a reason. Follow them, and you will have an amazing recovery with, you know,
Little to no
little
scarring.
to no scarring. You'll heal much faster. Even going to the tanning salon, getting spray tan, covering what little scars I had at that time with cream so that things could heal.
Of course, you and I, being so energetically open, we have our other healing methods.
We use Eastern and Western medicine in everything we do. Ellen Stern,
With her biofeedback and her
Right.
husband, Brian.
he's a Christologist, I think.
He does
That's what
the...
calls it. Yes, and Livestream, and so he...
Was that annoying
Yeah.
when I do it?
It's still annoying. Yeah. And what they didn't show you is how much I am loved.
And how this place looked like a funeral.
Did look like a funeral home in here.
You had like 12 arrangements in here. And I'm allergic to flowers.
My mom was really shocked when she helped change my dressing of how...
Excuse
Bless
me.
you.
Oh. It's flowers, I swear.
Just took a shower for the first time on my own. Mom,
Helped
she
you?
actually had, she helped me shower. She had to help me get dressed. And, it was
And
the
I
first-
was in shock when I saw him compared to a few days ago. I mean, he looks amazing. It's just beautiful.
He looks
I mean,
better, eh?
It's so beautiful.
Are you talking about the incisions or the actual size of the chest gone down?
Everything, the swelling, everything. I mean,
My bruising's minimal.
I was so pleased because I've been so worried about how he was going to scar and stuff. Oh my God, you should see it.
Really? Because I haven't seen it for a couple days.
Oh my God, it's crazy. I was so excited because it looks great. It's almost like he didn't even have it done. I mean, I can't believe it.
I wonder if girls, like, that get boob jobs, show their mom their boobs.
Do they?
I don't know.
Let us know.
I will never, ever, ever have tits. Ever. I will be the old guy now
Guess I'll come
at the
back.
pool at 60 because I don't have the extra skin that will not have tits when he's 60 or 70, and the majority of men will.
And I can't believe you said that in an interview that Dr. Cruz's office did. Just listen to this. Look at the clip.
And when I get older, I didn't want my chest hanging down to my knees. That's, you know, and the way it was going, that's what was happening.
Recovery in California is pretty sweet.
Yeah. It actually looks like we're on a cruise ship.
Yeah, surf and sand.
From our standpoint, what we try to do is just make it comfortable and easy, not a lot of time off work, predictable.
How much time is recommended for taking off work?
Well, usually we'll do it on a Thursday and they go back to work on Monday.
Wow.
Yeah.
My experience with Dr. Cruz was life-changing. I'm so grateful that I found him. I'll be forever thankful. The level of professionalism, being in the beauty industry, I've written, interviewed, I have seen other plastic surgeons, and he is in a class of his own. I'm just glad I made that call.
As you saw, I had liposuction. And with liposuction, I figured if I was going in to have this done, I wanted to have something that I could look forward to, sorta. So it was sort of like if I was going through this, I'm gonna do this. And I love it.
Well, we had to talk about it first because I'm a fitness
Yeah.
professional, and I think a lot of people are surprised about what my reaction is to it. We got a chance to sit down with Dr. Cruz and Jessica, and that came up in discussion.
Honestly, I eat well, I work out, I'm very healthy, and I still had this fat.
There's pockets that are almost near impossible to get at for whatever reason, and I just notice it from a fitness point of view. It could be drug abuse in the past, it could be certain medication that people are currently taking. There's whatever factors there are. Sometimes liposuction is appropriate.
No, I mean, it's funny how men will tolerate a few wrinkles on their face. A little bit of crow's feet, a cold spot. You know, even a belly, they're okay with.
Did you just look at me when you did that?
I don't think you have anything to look at.
Even during intimacy, like there's things that I was able to pick up on of low self-confidence that affected us, and addressing it is really, really tough because it also brings up a lot of those issues that he was bullied for as a child. A feminine breast is associated as being gay, bullied as a child.
My issue, I already was not the most masculine boy around, and so to have a physical attribute that added to that was really painful to me.
We're not alone. There's so many men out there that struggle with this, and what's great about that office, I think, is that they're so discreet. Like, they create a comfortable environment for these guys. Anytime that we run into another guy in the lobby,
there's like
it's always like just an understanding of awesome. This is great.
Yeah. And we set it up where you're watching a video, you're comfortable, and it's usually over an hour and 15 minutes.
And local
on the station.
Most men actually say it goes by really quickly. We actually have our iPad stand over here, but they're laying flat down, you have an iPad movie, you'll end up kind of just dozing off watching the movie, but most people say they thought it took 15 minutes. They'll wake up and be like, that was really quick.
Wow.
Yeah.
I love it.
It's a nice room, good energy in the room.
It's a good thing to feel good about yourself. So, we did this photo shoot, and honestly, you guys, they needed somebody to massage Craig. They just wanted the arms, and he was like, I love your tattoo, so we're just gonna have the hands. I'm wearing jeans and a t-shirt. He goes, well, just take your t-shirt off. And I was like, oh my God. And he's like, we'll cut you out and just have your arms. This magazine is no
Look at
longer
the photo.
anywhere.
There you go.
Yeah.
Take a look. And now, Brandon, how did you feel?
This made it to print.
This almost destroyed our relationship.
Thank you.
Yeah. Brandon, I think that's about it.
Yeah.
Yeah, I think that your boobs look amazing.
Thank
You look so good. You're very confident with them now. And it's helped us, too. It's helped our marriage.
Yeah.
Definitely.
It's helped our sex life.
It has, but not because I did not find you attractive before,
No.
because I totally did. It's a confidence
That
thing.
now I find me attractive. And that makes all the difference. So
It's an empowering thing. It's great.
yes. I want to leave you guys with this. All of this, plastic surgery, doing anything, this is to make you feel good. It's not, if you're doing this for any other reason, you know, you really need to think about it. I did and made all of my decisions so that I could feel good about myself. And then that way I'm able to walk into a place with confidence and put my best foot forward.
We love you guys. Thank you for watching Newlyweds the first
Thank
year.
you.
Wednesdays,
Stay
10, 9
tuned.
Central.
'Cause- Mwah.
Do you want some more coffee?
Yeah.
Yeah, a little bit.
Yeah.
Get you
Maybe I'll take some wine now.
Ah! Shot of Bailey's in it?
Yeah.
Now you're talking.